share information. We're just not going to make a lot of decisions.
Right.
Okay.
Perfect.
So going around the room, and if we could see your faces, that would be great. But if we can't, I'm seeing a black screen anyways. Do we need to give you a little more time, Salem, or are you good? Okay. So why don't we start going around the room in here and introduce each other. We don't have our little tabletop names. So I'll start with Merrimack.
My name is Sandra DeLosa. I'm the welfare administrator for the town of Merrimack.
Mary Ann Gamache. I'm a housing specialist from Greater Nashua Mental Health.
Bill Ayer, I'm with Voices on Major Drive.
Carol Brooks, SVTC.
Amy Hunt, disabled veteran, concerned citizen.
Yeah, I'm Janet Langdell. I work with SVTC. I'm also get to facilitate this meeting as chair of the RCC. Sir.
I am Johnny Arquezzo, and I'm with Meals on Wheels of Hillsborough County.
Donna Marceau, the Regional Mobility Manager for the RCC7 here at NRPC.
Salem Quinn, I'm the Administrative Communications Coordinator for NRPC. And I did just see Matt Lakins, who's gonna help me make the camera work.
Okay, so we have camera problems. For those guys on Zoom, we have camera problems. There's a lovely lady on screen in what looks like a light purple vest or velour.
Kathy.
Would you like to introduce yourself? You're on mute.
Sorry about that. Kathy Cormier, New Hampshire DOT, sitting in for Fred.
Hi, Kathy. We finally get to
How are you all?
Name.
Yes.
Thank you. Matt just
Yes.
walked in. And then I've got on the other side of Kathy, there's like a big green line with no face, but who is that?
That's Matt, who's getting the camera to
Okay.
work that I couldn't get to work.
So
But we have Deborah is on.
So Deb Retzi's on from Granite State Independent Living. Carrie Miller's on from Nashua Transit System.
So Janet, I just want to under full disclosure that I am in my car and I actually have Victoria Lee with me, who is my alternate, and I would like her to come to these meetings. So I just wanted to disclose that she is also listening to this meeting.
Thank you very much, Victoria. Hello, welcome.
Hi, thank you for having me.
Looking forward to meeting you in person.
Yes, me too.
That's wonderful. Thanks so much, Matt.
Okay,
You
Carrie's
get
still
non-video
online, right?
participants to show up?
Well, Amy,
There's like,
charge extra.
there's like 3 people online.
And then we have Marissa.
Hi. Can you guys hear me?
Yes, we can hear you, Marissa.
I'm an oncology social worker from Southern New Hampshire Hospital, working with Foundation Medical Partners. And I met with Donna. We had a meeting. Hi, Donna. And she invited me to this meeting, so I'm excited to be here.
Excited to have you, Marissa. And then we just did Deborah. We already did Kathy. And then we did Carrie Miller from NTS. So that is all our.
That is all it. Can you change that so that we can see the entire gallery?
I will see if it will let me.
Instead of just
To
the
show people who don't have their video.
Right now, I think it's on only view.
No, you're doing it.
There you go,
Okay.
right there.
You go for it. Or sort gallery by.
Okay.
If somebody else just strolled in.
Yeah.
Hey, we're getting there, guys.
You got my text?
I know, because my phone's sitting at home on my counter.
Okay. Traffic was parking lot on there.
Well, Deb Ritzy's on and she's stuck on the highway up around Cochrane, so.
It's ridiculous.
So for those of you guys who are on Zoom, James Wilkie from Caregivers just arrived. So that gets us to 1, 2, 3, 4, 5, 6, 7.
Did you count that?
Yeah, well, Matt's NRPC.
So Deb and I are actually on our way. We're going to be in person. We're like 10 minutes away.
Okay. Well, we're just gonna get going here. So we've got some minutes here, and I had just a couple of quick changes. These are the minutes from the November 20th meeting. And I can give these to you afterwards, in writing. But in the number 3, the third line, just a little bit of clarification around the end of that sentence where it says they had awards that they cared about. I don't know what the AI had to say that I said, but I think the intent really was, and I think it really did say, that they had planned to make the regional awards at the June meeting, but decided not to do that. So that kind of creates those 2 lines there. And then the only other thing is under number 5, second bullet in the packet is the SCC draft, it should say draft SCC.
Is that the second bullet?
Yeah.
Thank you.
And then the only other thing is, on page 3, the last bullet in the top area, where you have TYP,
Yeah,
you gotta write out 10-year plan.
sure.
Salem used to work for New Hampshire DOT, so she's familiar with all of these little bits and pieces of, abbreviations. Yeah. Did anyone else have any suggestions on improving the minutes or clarifying? So would somebody like to make a motion to, no, we can't do a motion yet. We're gonna wait a minute until everyone comes back. So we have nothing else there for now. We will move on. And because that makes a decision, we can't actually do it, but we can at least introduce. Amy Hunt is wanting to join us as a member of the RCC. Amy, do you want to tell us a little bit about yourself?
I'm a disabled veteran. I take the transit all the time. And I see a lot of things that need to be improved.
Amy brings lived experience and really represents 2 groups of people, both veterans and folks, living with a challenge. And your hometown, Lineborough?
Was Lineborough,
Okay.
but I grew up there.
Okay. So it has some knowledge of the region. We have got the paperwork done. Donna has it. Normally, we would ask for a vote from our members now to approve Amy's application, but because we don't have a quorum, we have 1 more person. We're gonna come back to that when Deb gets here. Any questions or concerns or any comments from the Zoom area?
So Janet, the only question I have without the benefit of obviously looking at them right in front of me, what did you want to make when you said it's a draft for the SCC? What is in draft form at the SCC?
At our last meeting, Deb, in November,
Yeah,
we had distributed the draft SCC strategic goals.
okay, and it had not yet been approved by the full SCC. That must have happened in December.
No, I think the final one I think you guys did was in October.
Yeah, so that's why I'm wondering why it's draft, because I
Well,
feel like we approved it before this November meeting. That's all.
Okay, then maybe we can strike that. I'll go back and clarify that. And look
Yeah,
at
I
what your
think
document says as a approval date.
Yeah, I think we proposed it in September and October and feel like it was approved by the SCC leadership in either October or November. I was not at one of those meetings, so I forget which one.
Okay,
But I feel like,
I'll double check that.
yeah, okay.
Yeah, I'll
That's the
double
only
check.
question I had.
Yeah, we've just seen a couple of different iterations since that time over the last few months.
Yeah,
And that may have been what confused me because the language and the structure changed just a little bit with each SCC meeting.
Yeah, and we had the full plan, which was, you know, like 18 pages, and then we gave that kind of condensed version that's like 6 pages long. So when I get there, I'll open up my laptop and I'll actually see the approval date, so I can mitigate that when I get there and look at it.
Okay, great. Super. All right, so the next thing we're gonna talk about at least, and this one is pretty exciting and important. We have a new possible provider for the community rides program. It was somebody that we had mentioned a while ago, and Donna, did Home Base reach out to you or did you reach out to them?
So what happened was that Cindy Yansky, who is the mobility manager for Region 3, they provide there. So I had always mentioned at our mobility managers meeting that we need at least one more wheelchair provider, if not more, because we've had conflicts where we haven't been able to provide rides for people because the one provider that we have was busy. So we needed another one, and then Cindy picked up on it. So Cindy sent me the information, and then I contacted Charlene. So
Home Base was one of the organizations that we had actually suggested before all of this as we were getting going, because they provide school transportation in various communities in our region. I know one of them is Milford, but at that time, I think that they probably were just starting out, you know, they had the school base, but they hadn't branched out into other areas. Well, that's good.
So anyway, so we have the contract here. She was very good in getting back the contract to me, like right away. But then I have emailed her in Salem, thank you, Salem. Also sent out a double RCC7 request to her. So that's good. So thank you, Salem, for doing that too. And I called her a few times, and she did leave me a voicemail yesterday that she was going to try to make it. So she could be in that traffic because I think she's based not close.
They're in Pembroke.
Pembroke, right.
Yeah, I'm pretty sure they're in Pembroke.
So hopefully that will be a good backup provider for us.
So if we were to use them, their mileage that they're going to charge us is from Pembroke to, let's say, it's a ride in Nashua, Pembroke to Nashua, the Nashua ride, and then back to Pembroke?
So that's a good question. I think we'll have to clarify that with her because the other providers, that's not the case. It's from the address they pick up at to the location. So we'll have to clarify that with her.
Okay. So you guys want to speak more to the memo? And the rate? I mean, is the 39.12 per hour and 53 cents per mile. It's a little different than what our other providers charge.
Other than what that question about, are they going to charge when they pick the person up, which I assume that would be the case, but this is their rate. I don't have anything to say about it. That's the rate. I don't know what
I
else
think that was a question that came up the last time we were talking about rates and whether or not it's ballpark or not. You know, from ballpark relative to the rates the other organizations are charging.
My sense is that it might be a little bit more because the way this is written, it's the per mile is way less than the others, but there is a 39 per hour charge. So if this is a plus, so my sense is this is going to be a little bit more, but you'd have to figure out on a specific trip if in fact it is.
Have you kind of worked those numbers out just for fun, like taking 2 of our wheelchair trips just to see what it would compare?
No, I could do that though, but I haven't done that. Just because I was really happy to get just a backup.
Well, the other option is they're the ride of least resort.
Exactly.
No, I understand. I agree with that. Yeah.
Right.
But I just think it's just trying to get all the facts on the table first to know what we're walking into.
Well, exactly. But also too, I'm really happy that she did this because, so many times, I'm kind of thinking, is Gentle Care Rides gonna be able, that's the, I'd rather provide it. Are they gonna be able to do this? So the fact that we have at least a backup, I think is good, even though I think this might be a little bit more, but even if you, I'll figure out I'll do some examples of it.
Yeah, we need to do a couple scenarios.
Yeah, I think that'd be worthwhile. And one of the reasons why they were suggested even from this area originally was because if they've got their vehicles down here and they're doing school transportation, if they can catch some other business while they're in the area, it makes total sense. And again, that was right at the time when they were on their website saying that they wanted to branch out into senior services. So,
Yeah.
yeah, John.
I don't have rates memorized, but what's the difference between the two rates?
So the other one is $4 per mile, plus $40 if there's waiting time.
Plus $40.
If there's waiting time. Sometimes there's not waiting time.
All
So
right.
sometimes it's just a drop off, but lots of times it is, most of the time it's waiting time.
Wow.
Let's do a couple of cost comparisons and then we can verify whether it's portal to portal or, just for the context of the ride.
Yeah, that makes
Yeah.
total sense.
That'll be fun. I like doing stuff like that. So try to figure out what's expensive.
Any other questions or does anyone out on the Zoom world have any questions or comments?
Somebody's in our waiting room.
Yep. Excellent.
I have a question. Is this just for seniors?
No,
Okay, all right, I thought, I wasn't told, but so I.
the 5310 funding, I know you knew.
Right,
The 5310 funding that governs the funding that we're talking about, that
Right.
this might be paying for, is basically geared towards seniors,
right.
folks living with a disability.
Mhm.
And then the caveat is other low income people, as rides are available within the schedule, those rides cannot interfere, but it's primarily seniors and folks living with a disability.
Right,
We
okay.
do have other funding sources, and do have our services. Some of them also provide rides for folks that are non-senior, able-bodied.
Okay,
So again, Sohegan Valley Rides, we work with Nashua Transit. We provide rides from our area out by Milford and Amherst and that to Greater Nashua Mental Health
okay,
for some of the folks who are, under 62 and not necessarily qualifying as disabled. Hi, come on in. Victoria,
Yes, hi, nice to meet you.
nice to meet you.
Yeah.
I have all these on paper.
So for those of you around the table, this is Deb Ritzy from the Granite State Independent Living and Victoria Lee. And we'll let them get kind of settled in. But
I move this
Hey,
too.
John.
So- Yeah.
okay.
we already, some of us do already serve clients that you would say.
And we also had Angelique join on Zoom.
Hi, good morning, everyone. Angelique Pandolf, Director of Transportation at Easter Seals.
Hopefully you weren't waiting in the waiting room too long. Sorry about that.
No, my apologies. I was late, so.
Glad you're here.
Thanks, Angelique. Nice to see you. All right, so with National Transit Online and Angelique Online, any votes will need to be roll call. So with these guys here, and we've had our discussion about the rates, I'm gonna stay on the rate piece of it. We were just talking about the Community Rides Pilot Program and the rate setting for home base. I don't know if you guys had any questions about that or not. I think we're gonna postpone that decision until we get the additional information.
Makes sense.
So I'm gonna backtrack to the approval of the minutes now that we have a quorum in the room. And would anyone like to make a motion? Would like anyone like to add any other clarifications to the minutes at this point in time? Other than the question about the draft. It's one word, so I don't think we're,
Janet, I can tell you that the LCC adopted those on October 2nd.
okay, then scratch that.
Are you looking for a motion to accept with the recommended changes?
With amendments.
So moved.
All right, Deb moves, seconded by, oh, thank you, Bill. All right, roll call vote. Carrie Miller, National Transit. Okay. Angelique from Easter Seals.
Yes.
Carol, SVTC.
Yes. I can vote even though I wasn't at the November meeting,
Yep.
correct?
Yes, from Merrimack.
Yes.
Yes,
Yes.
I'm gonna abstain because I wasn't there.
that's okay. And NRPC?
Yes.
Okay, so one abstention and otherwise unanimous. All right, now let's go back to Amy Hunt, new member. If there are no other questions or comments for Amy? Do I have a motion to approve Amy's application?
So moved.
All right, I got movement all over the place here. So moved by John, seconded by Carol. All in agreement, and we will now go again around. Carrie Miller. And Carrie must be on a phone
Yes,
call.
sorry, I'm all over the map today.
Okay. Angelique,
Yes.
all right, Matt,
Yes.
John, oh, you made the motion. Deb,
Yes.
Bill?
Yeah.
Yes.
Perfect. Welcome aboard.
Thank you.
And I think we have just now hit a goal that the SCC has, that every RCC has at least one member who is having the lived experience and can bring that to the table. So thank you very much.
Speaking for the SCC, I appreciate that because I think it's who we serve and we should be hearing from who we serve. So
Yeah, I got, now I can remember, I have issues with home base.
All right, well, we'll talk about those later. How's that sound?
regardless of your membership, you still are a consumer of RCC7. And I would assume that we would still want to hear whether or not you remember any concerns, right? Would that not be real?
Right?
Okay, all right. I just wanted to make sure that members know that they don't have to be members to have a voice.
And well, that's why we have the last thing on the agenda we always try to get to is member and community concerns and updates. And we've actually kind of minimized other things in order to try to get that into every meeting so that we have a platform for feedback.
Mhm.
Right. So quick executive committee update here. Executive committee met on January 26th. One of the things that had happened since our last meeting was that we got a request, the RCC got a request for a letter of support from Southern New Hampshire Health for a grant that they were going after with the New Hampshire Charitable Foundation around the opioid abatement money. And we took the information as the group that was, everyone was present, reviewed it and decided that we would do so. And we did submit a letter. And it got there before the deadline. So hopefully they will get their funding. They did mention specifically that they're interested in using some of the funding or looking at avenues to better improve transportation for the clients that are going through and taking the journey with them on their program. So that maybe opens some more doors. So Donna, thank you for making that contact. And NRPC also, as a separate entity, submitted a letter. So one would
Right.
hope that they would get this grant.
And then also the Gate City Bike Co-op did, and then Cultural Connections did as well too. So we tried to get as many letters for them.
Yeah, and two organizations that Donna sits on the boards of, so there you go. That's good. So we've got putting our arms around as many things as we can, pull everything in. People sometimes wonder when you're asking the same question at 4 different meetings, how many hats you're wearing. And Donna wears a lot.
And yet her hair still looks great.
God,
Dominoes are you on? Seriously?
you really flirting with her.
Carrie, do you feel up to giving just a quick update on where the locally coordinated transportation subcommittee plan goals group is?
Yes, I need I need a minute. Sorry, let me just find I'm sorry, guys. I'm out of sorts today, so hold on. Let me just.
Carrie's not been feeling well for about a week, so she's got, I think, whatever this respiratory thing is going around.
Is it COVID? No.
No, thankfully, it is not.
Sorry, Carrie.
Oh, thanks, Amy. Appreciate it. I'm just
Hang in there, girl.
I'm just trying to read the minutes because I'm trying to remember what we talked about at our meeting.
It's been a few months.
Having some short-term memory loss here from our subcommittee meeting. We had some homework from the January meeting where we were going to identify some stakeholders who we could invite to the conversation as far as getting information for or prayer or going through our top 3 strategies that we had come up with. So we, all gave our ideas and suggestions for, stakeholder groups or individuals to, to get in touch with so that we can get some input from them and how they can contribute to the top 3 strategies that we had identified. The top 3 strategies we had identified were communication and coordination, technology and innovation, and transportation services. We mentioned folks from we talked about Steve Workman, from the SEC, as far as contributing to the technology portion of the strategies. I had mentioned folks from the healthcare industry, as far as assisting us with communication and coordination. They're a big part of what we do. And what else did I think we generally just talked about, communication and other ways to, improve that, improve relationships we have and everything moving forward to just keep the flow of communication going better, as far as the website and just talking to each other and things like that. So, does anyone else have,
Yeah, and again, just to remind some of the other folks and some of the newer folks, the charge for this group was we had done NRPC is required to do what's called a locally coordinated transportation plan. And out of that came a number of areas of concern or ways to improve going forward. And what we needed to do was to take all that information, as multiple pages of information, and kind of distill it down and prioritize it to get to a point where there'd be some action steps of things that this group can do as a group. There'd be some things individually that our organizations can do to try to help, dovetail and work with each other. So that's really what this group is trying to do, is to come down with a working document that we can go for. A lot of the initial conversation did come out about communication, which was very timely because Angelique sits on that committee, and she also is eventually going to be the official champion, though she's co-champion right now, of the State Coordinating Council's strategic plan goal number 1, which is communication. So we think there's going to be a little bit of crossover. So we're waiting to hear a little bit more from them as we move forward on some ideas locally of what we can do. In terms of the technology and innovation, one of the ideas that came out of that was Camille Correa had sat in on the meeting, and she noted that Lowell Transit is doing an extension of one of their routes. And we're planning to have them come in, hopefully, for either the April or May meeting. So that would be a guest speaker to talk about and share with us what this expansion is gonna be, because quite honestly, it's really a great idea. I mean, we can get people that wanna go from this area to Lowell, they can then connect with the train and the other bus services down in Mass. So that's a plus side. So that piece came out of that one. And the third one, I think we were waiting for more info for you because that's the one where ADA accessibility and ridership comes in.
Okay,
And we also talked to Matt about.
do I know that?
Yeah, you do.
Okay.
And we also talked to Matt a little bit more about the was it 53, which grant is it, planning grant?
5305E.
Thank you, 5305E, which is another state federal document, monies to do planning and maybe looking at better ways to integrate service delivery.
Question?
Yeah.
Regarding the potential extension into the Lowell area, has this committee or, the people in Nashua identified that as an area of need? And if so, is it based on a social aspect or is it based on the medical aspect? Or maybe we don't know.
It was identified, Matt.
Yeah, we've done over the years a lot of different transit studies about expansion and a route to Lowell, the Gallagher MBTA stop station was always comes up as a need, a desire to get to, and also to UMass Lowell. And, there have been shuttles proposed and so on from the Nashua area to get over there.
Yeah.
But that's of course expensive and there's a grant program funding available in Massachusetts that Lowell Regional Transit Authority is taking advantage of to do this route. So there is a need.
It was medical, because I know it's probably not Saints anymore. It's probably something like, I think is that the issue, or is it like workforce, like going down
It's
into
everything.
Park,
It's
social,
education, it's
everything,
workforce, it's social,
That's
it's
nice.
medical.
right?
It's, and less medical though, because there aren't, well, less medical unless you live in Litchfield. Because when we were in Litchfield about a year ago,
That might be.
a lot of the folks that have moved up there have doctors that are in Mass and in the Lowell area. And that's something that they brought forward in our conversation.
What about the National Transit Express, Boston Express and all that?
No.
But that was taken away from them for their carriers.
No, it's not.
It's not?
No.
Okay.
So would it be considered a link to mass transit in Massachusetts? So therefore, it opens up a whole new world to people in terms of medical appointments, work, and entertainment.
Potentially, and I mean, obviously, they're trying to make the connections, the pickup stops and whatever, all kind of groove together.
So that's what we have to find out.
Well, no, I'm going from what Camille Correa said. I know that Camille has worked very closely with them as well.
So they've also identified the need for people to come up into Nashua.
I would assume so.
Tax-free shopping, yeah.
Yeah, New Hampshire's tax-free state.
Yeah, so that's nice if there is that collaboration of, the potential for that could be wonderful for people who live in the Nashua area.
Yeah, and there was a ride on the potential route, the general route. They haven't completely finalized it or identified the actual stops, but some folks from NRPC went for the ride and NTS, and they rendezvoused down at the MBTA station in Lowell and rode the route. And
Like opportunities for braided funding, like.
Yeah.
It opened some doors, and it's something that, and the impetus came from that area. The other thing too is we're very fortunate that our lead agency is also Metropolitan Planning Organization. So, and Matt is the manager. You're the MPO coordinator.
What would you like to be called, Matt? Just tell us.
Yeah.
Retired? No.
But also, just before I forget, the other thing is the director of Manchester Transit authority was along for that ride, and he's very enthusiastic about potentially connecting with one of wherever the stops are down by Pheasant Lane Mall.
Yeah.
They're hopefully the idea is those are also Nashua Transit stops. So they're connected into the whole Nashua Transit system. And then one of those stops would also be a Manchester Transit Authority stop.
And Camille had mentioned that too, because eventually it's that connection to Manchester and then, because Manchester then connects to Concord. So you're getting that further distance for folks that can use this level of service. You know, we're talking about fixed route services. So.
But again, that's exciting.
It is. It is.
Yeah. So,
you know, and hopefully they will have enough funding to give it a long enough time to really test it out. You know, I felt, and just as kind of throwing in a side point, we had all talked about almost 2 years ago now, with excitement about the extension that Concord Transit had done for workforce up to the Franklin Laconia area. And unfortunately, because of the lack of ridership and the funding availability, they had to curtail that route. And it was only a year old, and I wish they'd had one more year to move it forward, to try to really, you know, give it a chance to go, but.
and the only other thing I would say is that this service we're talking about is supposed to start July 1st.
Yep.
Get on it, Matt.
Get watch.
So.
I just think the opportunities are exciting or at least the possibility of opportunities is exciting for Granite Staters who, like you said, have the ability to use this type of service. Because it just opens doors. It opens employment opportunities. It opens social opportunities for people. Like those are what I think is a big miss in a lot of these communities is the social piece. Yes, the workforce obviously is one as well, but you know, the social piece, I think really, as I think everybody knows here, is the more we can combat those social determinants of health, the better we are as people. And I think access to different areas, like I just think of Lowell and I think of the fact that probably, and I don't know the number, but 65-70% of them are local Cambodian nationality. How do we connect our community of the Cambodian to the community that services really that? And I know it's changed over time, but I just think like that whole social environment is just important.
Absolutely. And that, I think that whole concept is going to be something that's going to come up again when we get to looking at this New Hampshire DOT survey and prioritization. Yeah, and I'm not going to tell another story. I got one about bicycles, winter, and getting from Amherst to Nashua to Lowell Connector and Hudson and down to Lowell, but we won't go there right now. It did happen. So Carrie, sorry, we kind of went on a very good conversation here while you're back there. Did you have anything else you wanted to add, or Angelique, did you have anything else you wanted to add relative to the LCTP subcommittee?
Thanks for bringing up the Lowell route connection. I missed that or I didn't remember that, but that was very good. And then the other thing was we're just plugging along on the subcommittee. I think we're having some good discussions so far in the last couple of meetings we've had. So, and yeah, we're gonna get together next month and plug along. So thanks.
And that subcommittee, for everyone's knowledge, is next meeting is when?
Oh, when is the next meeting?
I'm sorry, I didn't pull my book this morning to put it in front of me.
I'm sorry, I'm blanking. I apologize. I'm not clearly today, but I have it written down somewhere.
Yeah, we'll toss it into an email after the meeting, just so everyone's aware when that group's gonna meet.
Thanks.
And then when the executive committee is gonna meet again. Okay, so just kind of cleaning up the executive committee update. The only other thing I wanted to make sure that we got on into the discussion today was kind of an update on funding for and utilization of funding for the first 2 quarters. Is there any way you can put that really ugly chart up, Salem?
You mean the one you sent this morning?
Yeah,
Is
I-
it on the S drive?
Not yet, but
Okay,
I can take 3 minutes and if we could.
well, everyone in the room has a copy of it, and
but they
it's
don't.
just for the benefit of those guys.
Okay.
Um,
in the meantime. Let's say on the agenda when the subcommittee is gonna next meet. Bummer.
We just met on February 20th.
Correct. And before that on January 23rd.
Yeah,
we're meeting on the 20th.
of March.
Yeah, it'll be March 20th, 10 a.m. and it'll be at NTS.
Great.
I don't think it's in the calendar yet because I don't have it and I know I should be, but I can tell you guys right now, I'll be out on a medical leave that week.
Okay.
So I won't be there.
Okay.
No, I really want to go.
Okay. Matt's gonna pull it up, but for those of you guys who are in the room, so you guys know out there in Zoom land, what we're gonna be looking at is a document that I actually gave Matt to put on the screen this morning, and we've got copies in the room. We will email this out. It will be part of the final packet for this meeting. And it's just that grid reporting out on what the billing and funding has been for the first 2 quarters of the fiscal year. So that the first quarter is July to September, and then October to December. And this is something that the SCC
Thank you.
expects us to do. It's in our bylaws, and I just wanted to make sure that, we got this done.
He's throwing his cane at me.
Well, he's a mean guy sometimes. And I can tell you that we are on track. Everyone is still reasonably within budget. The one item on here is the regional mobility managers funding.
Like
And
these children.
that certainly looks, like it's almost done for halfway through the year, but it isn't. I just remind everyone that the RMM position funding is split between the 5310 RCC funding and NRPC's UPWP, which is their contract with the state of New Hampshire Department of Transportation. So from a billing perspective, NRPC, as our lead agency, likes to bill out this monies first, and then they will use the other pot of money. So Donna's not going away.
Thank goodness. I was getting a little nervous that we were gonna stop seeing Donna after February.
Never.
And the caregivers fund, just to remind everyone, is used for administrative purposes, for advertising, for, I would say, volunteer recruitment, and possibly some retainment too. It's always nice to see your ads on TV.
They help everybody.
You do.
They bring in awareness,
Is it the TV or the social media? Which is better?
social media.
Yeah, and they've been doing a
You have more
blast
of
to
it,
them
like
out.
it's easier to access than the TV. And the TV is predicated on when anywhere along the slot. So
Yes.
4 AM doesn't work a lot for us either.
And the Greater Nashua Community Rides Pilot Program, which hopefully next year we can get rid of the word pilot and keep this going. That's again funded by the 5310 funds and then funds that are coming from the NRPC Foundation. I will note that there was one ride that was rejected by New Hampshire DOT. And the cost of that ride was fully absorbed by the foundation. Obviously it had to be paid. It was the taxi ride from Merrimack to Wilton.
Ouch.
It was only $65, but still. We just couldn't show that the person was, I think Fred was asking whether it was disabled or elderly. And we knew she wasn't elderly, but we couldn't show that she was disabled. Even though she lives at subsidized housing in Wilton. Whatever. And then the Sohegan Valley rides, which is the NTS, which is the top line. Again, that is budgeted out on a number of hours per month, so we definitely have it spread over the year. I will say that in talking with Nashua Transit, Lori Lorman, who's the operations coordinator down there, we were remarking on our rides are down a little bit this year. And she said it's system-wide. No one's quite sure why. But from a perspective of, paratransit and I guess a fixed route, it's down just a little bit.
And you say this year meetings from July first, not most recency.
Yeah.
So the
So
other.
it's not only weather dependent. I mean, last
It's
month,
not seasonality.
we lost 3 days of service basically.
Yeah.
And all of those rides had to get canceled.
So I have a question back to the DOT asking for a disability. Because I think everybody knows in here, we can't ask that question. And I would be curious as to define how they define disability. Because I guarantee you, there are people who self-identify as living with a disability because they can, according to the ADA, and that is because they have diabetes. So, for me, I take a real hard stance on, you tell me what you define, because we should not have to say to a person, identify for me, you live with a disability. If somebody is trying, unless it was overusage, then I could say. You need to
Absolutely, I
disclose.
absolutely understand where you're
But-
coming from. These are some of the questions that I asked too. What we realized though was that the application form, it's supposed to be filled out for every passenger on that
Yeah.
program,
She did.
needs to have the addition of, do you have a disability? Are you
It's either,
self-reporting
do you
disability?
have a disability, or have you had a disability? Because that disability, while maybe, they had a disability, but they no longer have that, that is still appropriate under the ADA if they have previously. And I'll send you our disability form that we have that is ADA and the Rehab Act.
Yeah, shoot it over. Yeah, shoot it over. I'd love to see
Because
it.
there are different things. Do you self-identify as living with a disability? Yeah, or no, I do not have a disability. Or have you been diagnosed with having a disability in the past? Those are things that allow you to check the box for a disability. So because here's the thing, lots of people don't know that diabetes if you have to live on some type of assistive technology, which is insulin, diet dependent, hearing aids, all of those things. I identify as living with a disability because I don't hear out of this ear, but you don't know that. I mean, I disclose it to people because I'm like, talk to me over here. Like I'll sit, my position will be seated. I'll sit appropriately. I'll never sit on that side. I like the corner. But those are things you don't know. Arthritis has you as a disability. It's not walking, maybe it's in your back or your shoulders or your hands.
It's a hidden disability.
It is.
Yeah,
So
no,
I will
absolutely.
send you that form.
Send the form because I'd like the language so that we can clearly modify the current
We have to
application
send
form.
this to our federal administrator, the Administration for Community Living, because it's a requirement of our employees and board. So
I think that this may have been more of an
I take
issue.
issue with him telling you can't do it unless the box wasn't checked.
I think this is more of an issue of a lack of documentation at the time of this conversation happening. And
That's fair.
nobody wanted to challenge it. It's $65. Okay, I wasn't in the room.
Those $65 add up.
I
You're
think it-
lucky it was a $65 ride, not a
They do.
$400.
That's when we immediately realized that we missed that one piece on the form, and that we're going to add it. So send me the language. Yeah, so we are on track. Not that it has any pertaining to anything here. But when I look through all of this data from last year.
Cottage Street, Spring Street, Nashua.
Hey.
Sorry.
Merrimack was on our list, and I just want to touch base since you're here, because I was thinking about you last night. Are you guys all set, do you think, with your budget this year?
Well, we did put the full amount in the budget and it was approved by town council. But voting doesn't happen until April. So, we've been in default for 2 years. And, of course, there's some concern that we could go into a third year of default. But last year with the default budget, they were able to, kind of move some money around in the budget and was still able to fund the transportation in full. So that's the goal this year again.
Okay.
With the fertilizer brewery throwing out some of Merrimack,
Oh.
that's gonna create a lot of budget pressure and people might not vote for an increase because of it.
Yeah, there is, concern of a third year of a default budget.
I know you'll be out of maternity leave, but have your
Text
town
them.
administrator or whomever who's following you, if something happens, call.
Yes, absolutely.
You know, because we want to be at the table if we can help in any way.
Yep.
Though funding is going to be, I mean, after this coming year, funding is going to start getting pretty tight on this end as well.
Yeah.
More so than it has been in the past.
I think the difference between last year's funding and this year's funding for the transportation contract is only about $3,000. So I'm pretty sure that they'll be able to, you know, pull from different, if there is a default budget. There hasn't been conversation about concern about funding it.
Okay.
So, but of course, that's, you know, you never know.
Thank you. Thank you. It is of a concern, not because it's National Transit, it's more of a concern because of the fact that it's Merrimack, you know, our second largest town in our region. And there's a lot of need there. And other than this service and caregivers, you know, it goes, and you're limited to by the number of volunteers you have available.
Yep.
Okay, did anyone have any questions at this point? And Matt has got, thank you, Matt, for getting that up for the folks at home. Any questions about this report? Okay, moving forward then. So the big ticket items, and I'm just gonna do a time check here. It's what, just a little bit before 11?
11:01.
Okay. The big ticket item here is New Hampshire DOT sent out a survey. And this is from Fred Butler. And maybe Kathy can share or clarify something that we were kind of not wondering about. We weren't sure whether this survey was strictly New Hampshire DOT needing information as they work through their financial planning piece and program planning piece, or if this was the survey that was referred to by Steve Workman as the provider survey that would be coming out relative to the statewide community transportation needs assessment document that's being done. And that's a separate statewide study that's being done around community transportation. Kathy, do you, I don't hate to put you on the spot.
I don't know,
Okay.
but I'll make a note and ask Fred.
Okay, thank you. Thank you.
Yep.
Irrespective of irrespective of that whole point, this is gonna be done kind of as a group effort, and I will submit it if they want one person submitting the information. So I wanted to make sure that you got this for possibility of having some talking points here or having some, you know, input in terms of what we currently do and what we might want to do in the future. And I did put together some information that we gathered from most of our primary providers. So we got information from the Greater Salem caregivers, from SVTC. I pulled some information from the CVTC's website, so I'm not sure if it's, and I was trying not to rely on website information because we know how that goes out of date easily. We were trying to contact individuals within each organization to kind of get a sense. Currently in our, and that's the document you guys have handouts for, and you guys, I'm sorry, it will get emailed later on. But currently in our area, you know, one agency limits rides to 3 per week. Another limits rides to 1 per week. But again, in both of those cases, exceptions are made for things like chemotherapy and dialysis, and also based on volunteer availability. Another does limit people to 2 rides per week. And then within each ride with that agency, they can ask for 2 or 3 trips in between. So if they were going to the doctor's office, they could then ask for a ride to go to the pharmacy and maybe the grocery store and then home. That's a little different than some of the other agencies in terms of how they count, but kind of gives you an idea that they are putting some limits on it while trying to be as flexible as possible. And then in periods of very high demand over at Sauhegan Valley with National Transit, what we had to do was to implement a policy that if the demand gets up to the point where it's hitting on our monthly hours, so we're routinely seeing that we're really close to going over or hitting that top mark, then we limit rides to 3 per person for non-medical transportation. So again, the
Per
price.
month, like 3 per month
We-
or 3
3
per?
per month.
Yeah.
Yeah, 3 per month. So again, all of these agencies that we contacted, non-emergency medical transportation is listed as the first. And everything else is kind of, if there's availability in the schedule, if there's availability of drivers. We certainly try to do that, especially around grocery shopping. And grocery shopping perhaps over a ride to Pheasant Lane Mall kind of thing. Though the social aspect is very important, and that came through too in the feedback that I got from every agency. You know, the idea of folks being able to get out and avoid social isolation. The other piece that came.
Can I comment on that?
Yeah, go ahead.
I think that's the key, is when we put, and you touched on this, Deb, an external value of a trip. You know, doctor's appointments versus something else, because the isolation is really a major issue.
Mhm.
So
Yeah.
I just wanted to.
Well, we had a client over in Amherst who she didn't really need to go to the doctors, but she needed to get out of the house. And this is for her own mental health, well-being. And yeah, she was getting a ride to go to the library. Perfect. You know, and again, that serves, it serves a similar purpose.
And I see it
Well-being.
when I do, so I'm a volunteer driver. And I see it, and I wish my volunteer driver program, which is not.
I was gonna say, where at?
It's not caregivers, would say yes or no. Yes or no, this is or isn't acceptable. And that is when I take someone to go to wherever they're going. So, I mean, I've taken people as far as into Mass Ioneer. I do it for Future Insights. And then I take people to a peer group that's literally in the town of Derry where I live. And oftentimes the person that I'm taking will say, can you take me here? Every single time and I book mine so that I'm not right at work and have to get back to work. And I say, absolutely, where would you like to go? And, what do you need? Do I need to go in and get it for you? Or is it just, I just need to go to the bank? So I always feel like those are the important things that I feel like I can do. I make allotment of time for that. And I know Future Insight, their philosophy is, we ask them not to ask you to take them more than they're scheduling on their thing. And I was like, I know, but that doesn't work for me. You either need to say yes or no, I can or can't do this. You either need to say no, you have to say no every single time, or you say yes if you can. And that's where I kind of get in the middle of wanting to give them an experience. I mean, first and foremost, we all know the experience is just riding with me, but I want to give them, but I want to give them, like, if they need to go to the bank or CVS or whatever, I had one person say, can you take me over to get my new orthotic shoes that are ready for me in Nashua? I was like, sure. And we were in Derry, because I want them to have that. I don't want them to fret about, am I going to be able to ride to go over there and get my orthotic shoes? So I don't know how that plays into answering these questions from a volunteer driver perspective.
I'll give your perspective on it.
Yeah, please.
So if we tell you, if I was to tell you,
Yeah.
you volunteered for me, nobody would say hi.
I don't want to say hi.
If I told you no,
I would love that answer, because then I could say no.
you're gonna feel guilty when you have to tell them no. You're gonna take them anyway, and you're not gonna tell me you took them anyway.
Oh,
So
no.
I'm not gonna have it on my books that we gave this leg of a ride. So when I'm applying to my funders for money, my numbers are down. If I tell you yes, every time you take somebody and they know they can ask you, they're gonna take advantage of you.
I know, and that's why I say,
And
tell me
again,
no, and
if
if
you
you say
don't-
no, I'm gonna say this is their
Report it
policy.
to us, we don't record it,
I do report it.
that's great.
I go in my system and say, this is the ride I did from my house to the doctor visit, added on a ride to CVS, added on a ride to the bank. Like, I document the whole experience. But you're gonna ask Victoria, I am a policy person, whether or not I like them or agree with them. And if you said to me,
But not
Deb,
everybody
no.
is.
Right, but if you said to me, I would be like, no, I'm sorry, I can't, it's a policy of caregivers that I can't do that, I'm really sorry. I would follow that, but I do document it in the future insight tracking system so they can see.
See, now, I'm just gonna point out one thing too. This is where my head's going. Future Insight, do you get reimbursed for mileage?
I do, but I don't accept it. I
Okay.
take it in kind and
And
give it
your
back to them.
volunteers
Do not.
do
They're
not.
not, yeah.
So for another agency, it might come down to when they're planning financially,
Yes.
and if their volunteer drivers do get reimbursed, adding on those extra miles.
Yeah.
Um,
They benefit from me.
and again, I think
But I
it's a
do-
mission issue,
Yeah.
and it's a planning issue
Mhm.
for a particular agency.
Yeah, and I do fill out the expense report like they ask, and then I zero it out at the bottom because I don't want their money. I want them to reinvest it in their program or give it to somebody else, do more rides, whatever it is. So I don't accept the money. I give it back.
Yeah.
I actually, I don't give it back. I don't even accept it. I zero my expense report out.
John?
So the survey is very important and everything about it is really nuanced. And so number 4 seems to be the key.
What I wanted to do was to open up the discussion,
Yeah.
because I think number 4 is the most important one.
Yeah.
This was my way of trying to get the discussion open by having a what do we do now? What's the experience now? Thank you. So moving forward, again, the first questions are in number 3 are, in the future, basically, if there was insufficient monies, how would you feel about these strategies? And the first one is limit the number of trips an individual can take per week. The choices are like, no way, preferably not, maybe, like this, love this. I mean,
I didn't love the survey.
no, I didn't love the survey either. My intention with this was to make sure that somewhere here, where like number 4, there's a lot of more text added from this region. Because I wanted to say, we are already doing that at our agency level. Do we like it? No. But it is a strategy. The next one was implement needs-based restrictions, veterans, individuals with disabilities only. Those are just examples.
And
there was-
that's such a sticky wicket because to have to rate somebody.
More important than the next.
Yeah, I mean, a
cohort.
veteran or not, that's easy. You can say, oh, really? But say your disability matters more than that disability.
That's exactly the feedback. That's exactly the feedback that I got from 2 agencies.
Yeah.
Exactly the feedback. And so I think based on that, my feeling would be, and I hope this is what I want to know, does this reflect what you guys are thinking? That this particular one to limit something beyond a resident of the community, living in our community, beyond that, I wouldn't want to put any restrictions on it. I mean, we have to do age and we have to do, the other groups with the funding, but these special groups like veterans or, people with purple hair.
Yeah.
Because there's gonna be some bias
Yes.
on that, sadly.
Yeah.
Or, think about people who live with mental illness and getting on a bus for them in and of itself could be a trigger point. Now all of a sudden, like, let's limit the mental health spectrum, which is just as important as somebody else who has a physical disability. I'm sorry, my veterans stand very high on my pillar of helping, and it's not a political campaign, but I think doing that just sets us up for failure. It sets us up for complaints. It sets us up for discrimination. Like, it just doesn't feel good. Because again, I don't want to pick who's more important, me or John. That doesn't,
Anyone on Zoom want to pile in on or join in on this conversation?
Yeah. Agree with what's already been stated. I wouldn't really see that as like a feasible option. The second option here, I feel like probably the third thing about prioritizing like medical appointments and then limiting number of trips is like the most feasible route.
Yeah, I think the one that says implement trip purpose restrictions, I think that gets to what we were talking about before, relative to social interaction. You know, for somebody, going to the grocery store may be a high point because everybody goes on Thursday afternoons. In Milford, it was yesterday afternoon at Market Basket, Wednesday after 1 o'clock. Everybody was there, including me. I can see having to prioritize, but again, I think the addition to what's said here in this little groove where you pick no way to love this, is maybe have the ability to tier it. So priority is NEMT, but again, exactly what we're doing now. Availability is based on scheduling or driver availability of what we can do.
Well, talking about that example, Janet, I see that as an opportunity. If we know when the sweet spots are for when EBT and social security checks are dumped into somebody's bank account, that's when we can say, hey, we're providing a bus to Market Basket on Thursdays at 2 o'clock. So for there, I think you don't have to worry about eliminating it. You could actually call that out as that special ride. So it's going to have lots of a variety of people in there who you can plan that. You can't plan the medical ride, you can't plan that, but you can plan that social event. And then they have to determine how long they're going to stand in the middle of the aisle and talk with their friend who they haven't seen in a week, or how much time they're going to spend shopping to get everything they need. So I think that example is a great example of how we can identify streamlines.
And I think that fits into some of the other suggestions that came from gathering some feedback. A strategy that maybe looks at geographic zones or looks at days of the week or special scheduling around certain things. You know, maybe and it could be by town, it could be by area. But, you know, if we know that the senior center is open and Meals on Wheels is doing something on a particular day, maybe that's the part, you know, we make sure that there's something available there. Or again, it's using some different variables to structure it. What do you think might help improve Merrimack? I don't mean to pick on Merrimack, but I know you've got a base over there to work from.
I mean, I do like the idea of, you know, scheduling something based on when Social Security comes in or when the food stamps comes in. Because that population needs to get, you know, that's really when they're looking for the transportation. So I would definitely agree with that.
I don't think there's a way that we can answer this, and I'm glad you're taking the lead on it, Janet. I don't think that there is a way that we can answer this and it be 100% representative of who we are and what we do. Because these questions are literally almost asking you to compromise your mission.
Well, if you look down to number 5, it's true or false, your region. Well,
yeah,
it's true for some agencies, but not for all agencies. Go ahead.
I think what you do is just answer maybe on all those. At number 4, you state the values.
Yeah.
We don't discriminate against different disabilities. We don't prioritize generally based on activity. Budget limitations may have an effect on limiting some availability, but really the availability of volunteers and drivers is key. And that's all many times based on funding. So I think it's a statement of values, really, that you're gonna end up doing.
It's funding and it's staffing.
Mm-hmm.
It's the two parts of it. Yeah. No, and that's exactly where I was going with this, and that's why I said I think number 4 is going to be really where all the meat of this is.
I think sadly, this questionnaire came out based on the Rural Health Transformation Grant and what piece transportation may or may not play in that, which we don't know about. But I think in my opinion, not because I have validation of this, my opinion is that there's something that's been issued and DOT is working on whatever that transportation piece is.
It was kind of part of my
Yeah, and
thinking
I don't
too.
know
I'm
that.
not
So,
sure.
you know, Kathy can tell me not, you know, that she doesn't believe that to be true. But my guess is that this questionnaire might be helping something behind the scenes with the rural health transportation.
Carrie, you've got your hand up.
Yeah, thanks. I think Deb and John just kind of said some of the things that I was just gonna say, but I I I was unsure whether or not like this survey was applicable to Nashua Transit because we are a direct recipient of FTA funds. And so I don't think that anybody is going to triage our funding out elsewhere or divvied up or something to someone else. Like it's for us. So like, and also we do have like, I mean, some trip priorities on, you know, like Merrimack and Hudson and our senior service. We are not allowed to prioritize trips on our ADA complimentary paratransit service. Everybody is, you know, equal across the board on that. We take everybody, but the other services we would prioritize medical appointments. But I mean, I just wasn't sure about this whole survey thing and I just wasn't comfortable with it. So
Well, I'm sorry you weren't comfortable with it. I thought in the email that we had, or I'd written it out enough that the one that I sent to the providers, that this is basically kind of a general looking for strategies. This isn't to pin anyone down or whatever. And I was hoping to get the input from NTS specifically around any prioritization that you guys do for in the Merrimack and Hudson areas. We understand that for the ADA paratransit, it's federal rule.
yeah, and also the other thing too is I did pass that a request along to Camille because, you know, I don't make those sort of high level decisions as far as like you know, like so I just wanted her to be able to weigh in on that too. And I think, you know, that like we contract with the towns of Merrimack and Hudson and SPTC for those services. And plus like, you know, our availability and space on our service also depends on like the number of drivers we have and the number of vehicles we have. I mean, we are public transportation. We don't have limitless resources out there. So, you know, I mean, that's like a huge factor in everything we do as well. But yeah, I was just sort of, I guess those are just my thoughts.
Just so the group knows that the same email that was sent out to all the providers, which was basically the ones I listed before, Camille Correa did get a copy of it with a request for some information, but we didn't hear from them.
Okay.
So that's a whole, you know, we know that you do something over in those two towns, but we just don't know. We're just looking for strategies, Carrie. You know, again, I think any kernel of thought, any example from any of our current agencies may be a platform for another idea.
Okay.
Or to
And
expound
that's,
on that.
yeah, and sorry, I didn't mean to like overthink this or be, you know, over dramatic or something. I guess I was just trying to like sort through what this was all about. And I apologize for not responding as well. I mean, we've just been, you know, everybody knows we're working on our triennial stuff right now, so it's just kind of stressful. But yeah, I mean, as far as trip priorities, like I said on, I would say Hudson, Merrimack, and senior, you know, we prioritize medical appointments. Obviously we take people to the grocery store and, you know, for the senior service, if whenever we have room, we take people to like the senior center and stuff like that. But and generally for the most part, we can fit in all the trips that people request. Just as sometimes like there might be a day when the schedule is really full. So we might have to like adjust somebody's trip time if they're going to something non-medical, like if they're going to the hairdresser or the senior center, we would just say, hey, can we take you at this time instead of this time? But that doesn't happen. It's not like it's a daily occurrence, but it does happen sometimes. So I think in general, those are sort of like our trip priorities.
And the other thing that Nashua Transit does too, again, for at least I know for our clients, if somebody wants to go shopping, let's say on a Thursday and it's booked full, they will ask them to go on Friday or Wednesday or just change the day. I mean, and
Yeah,
that's,
exactly.
again, that's the flexibility. It's
Yep.
trying to look for some flexibility.
Yeah.
And you're not using zones or anything in either of the other two towns, right?
Zones, what does that mean?
Okay, never mind.
Okay.
That means no, means no.
Okay.
Kathy, I saw you had your hand up. Did you want to get some input?
Yeah, I will get clarification from Fred where this is coming from. But I know we've had discussions in our office and in other regions come to mind where it's like there's only X amount of dollars. And so how do you stretch those dollars? So I think I would just try to answer it as a genuine request from us to help us, how are you stretching those dollars? How are you triaging it? How are you setting priorities? Are you doing those scheduled events or things like that? So that it just helps us understand better on how to do that. And then, the survey can be shared with everybody else too, because as you know, you're all working together for a common goal. And it's just wonderful to hear all the wonderful things that you guys are doing and how we can help each other improve and get better.
Yeah, thanks, Kathy. And I think we're all on the same page here, relative to it's a statewide effort. And we're all trying to, get rides for our people, whether it be locally or get into another region or whatever. And we all recognize that there are limited dollars, whether it be governmental dollars.
I think the survey, I'm a proponent of surveys because it's the only way we find out. I just don't think that this is the most meaningful way to have presented the survey with having to answer. I would have rather 3 open-ended questions to be able to really identify, well, we'll do this in that circumstance. However, it's not predicated on their disability or what, so I think to answer those couple questions that ask you to have a scale is hard because I don't think it's that cut and dry.
It isn't, especially when you're, I'm just gonna add in, especially when you're representing multiple agencies and one person's answering this. Go ahead, Kath, sorry.
So say that, right back to Fred, and say that. And just, there's always challenges with trying to create surveys. And if there's more that needs to be said, let him know that.
I think
don't feel constricted to this survey. If there's more that you want to say about this survey, then please share that with him. I think that would be helpful.
So I think our message needs to be what I would say as a voting member of RCC7 in 3 and 10. One of the things that I would say is if you have not had an end user part of the survey making process, I highly recommend that. Because the end user is going to see this as the end user and say, I understand now why you're asking that question, but this isn't how we can literally answer this question. So I just think in the future, it would be great to have an end user be part of the development of this because there's too much ambiguity in my opinion, for us to answer this in a meaningful way unless they were all free-form questions. Because everybody here brings up a great reason as to the why. Well, we don't do this, we can't do this, we need to be mindful of whatever. So I think that would be a recommendation that I think you should I would recommend putting on there. And it doesn't have to be us, it could just be anybody, but somebody who's in the day-to-day weeds of transportation.
No, I agree. And just to follow up on what Kathy said, have no fear. I think Fred knows that from this region, we'll ask some tough questions.
That's how we, you have to.
Exactly. Okay, I just want to go back to number 4, which is any other ways to triage funding than those listed previously. Does anyone have again, this is the free form part of this event. Anyone have any other suggestions they want to throw out? Any thoughts on how you could leverage the funds, but stretch them out and triage them and prioritize what you're doing? Done.
Would it be, I don't know, appropriate to ask people for their income and then people that are higher end income maybe wouldn't, you could triage that out that way, like certain income would be allowable, but certain wouldn't? Or you suggest other things like private transportation?
I think that's a possibility. Again, I think that's part of the mission. I think some agencies already do that. So they are serving of a specific lower income group. Other agencies don't, but that certainly is one way if that's your target population is lower income. But that again takes an overhead piece too. So the cost, you may have additional costs because of that, because there's paperwork and information to go through. It isn't just getting an email that says I'm low income. There is forms to be done. It's the same way with getting of how strict are you from self-declaring disability to requiring either the federal form to be filled out or a letter from a physician. You know. Good thought. Anyone else?
Just to piggyback off Donna, you know, maybe you could do like a sliding scale too, where, you know, I know National Transit, you know, for Merrimack is like $2 or $4. But if maybe they are in a little bit of a higher income bracket, that they can pay a little bit more themselves.
That's again another great possibility too. I mean, the fare bucket doesn't necessarily, it helps.
Not
It
real
helps.
fair.
But
Might not be real fair.
yeah.
Yeah.
But it's another thought. And the other thing too is, I mean, you just brought up a really good suggestion is, you guys do different fares for different areas. You know, so there's that tiered fare. And I'd forgotten about that one because we were flat $2, but you're 4 and 2. And I think Hudson is even more. I think they change, but they're a little bit more. So a ride within town or a ride to Nashua, to and from Nashua. Any other thoughts? Angelique?
No, I think what everybody said what I was kind of thinking, so I agree with it. It's a complex situation, so we should just try to do our best to note some of the nuances if we can.
I'm gonna leave this a little bit open-ended for the next week or so. This isn't due like tomorrow. This only came out at the end of last week, like at about 3:47 in the afternoon, you know, kind of thing. Typical Fred. Love him dearly. Oh, Kathy, hi.
Just, yeah, just a thought. This is a conversation that was part of maybe 12 years ago or so, not at HHS, but somewhere else. And you mentioned overhead. And so it's like, how can agencies work together where they can help each other in such as ways to help reduce overhead? So I'm just going to use this example. The conversation I was in a while back was about like Meals on Wheels. How could they maybe get together and maybe together they all order food from, or pre-made meals, whatever, from XYZ company by getting a big order, maybe you can reduce the price per meal or something like that. So I'm just sharing that. I'm not directing or anything like that. It was just a thought. It's like even insurance, I don't know all the legal rules around insurance, but if you come together, is there a way to help reduce those costs? I'm just thinking.
Well, but that's a good thought because quite honestly, it gets to a strategy of instead of cost per ride, we're looking at more like what Region 10 does. Region 10, which is over in the Portsmouth area, Seacoast area, they have one point of entry online as well as one application form, essentially one application form. So they're kind of combining all that work into one and it's one cost. Again, that's another thing, another way that you might be able to get around it if you can get all the agencies to work together and want to participate that way. You know, one of the challenges I think we found across the state is a lot of organizations want to do their thing the way they do it. And maybe don't have the capacity to do that kind of sharing, but that's again, exactly what you're talking about is another possibility of if you could do like what Harbor Care did down here, there's 4 or 5 agencies that kind of combine together. They also do provides different things. And maybe you probably speak to this a little bit more than I can. I know Greater National Mental Health is not part of it, but they kind of came together so that the overhead was being covered by one group and it didn't have to be replicated to other groups. Oh yeah, it was Harbor Care and the Home Care Agency and Keystone Hall and
I know they're all under Harbor Care. Right,
yeah.
right.
But
Instead
part of that coming together was,
Right.
and again, this goes back 10, 15 years.
Yeah, right.
So those
Wow.
partnership for successful living, they used to be separate and then they
Right.
put them all together
Yeah.
under the partnership. But that helped them a lot with administrative, like they all have the same CEO, they don't have separate
That's,
CEO.
and that's the kind of thing with structure we're talking about in terms of cutting down. It's exactly what the state of New Hampshire suggested in House Bill 1804 or whatever about combining SAUs. I'm sorry, I'll stop being political now since Kathy's in the room. No. It was a joke. That was a joke.
I know. But I think Harbor Care, though, as I recall, there was some investigation with the AG's office and stuff. So
Yeah, well,
Yeah.
Well, that was what happened.
Yes.
I don't know
Yeah.
I don't know the details, but I know there was something going on.
They're publicly available.
Yeah.
they are. Matt, did you have any thoughts on this?
No, you guys have covered pretty much everything. that I would-
So as a next step, what I'll do is take the notes together, put a kind of a draft. I'm gonna send it out to the executive committee, just for them to put some eyes on before any of this goes out and, get a blessing from kind of the next group up kind of thing, if that works. Saving it from sending it out to everybody in the distribution list, which a lot of those people aren't even, aren't here today in conversation. And if you have any other thoughts in the next week, drop me an email.
Janet, I have a question before you maybe officially end this meeting. I'm just looking at the agenda and again, I came in late, so I don't know. I'm a little off cycle here. Did we talk about the community transportation pilot program on the community rate in trips, the rate per trip?
Yes, we did.
Okay, did we vote on that? Do we need to
No,
vote
we
on that?
didn't. We postponed it because we had a couple
For
of
next-
questions.
Okay, perfect.
More information.
We wanted
Okay.
more information about portal to portal
Yes, okay.
and,
I wanted to make sure I didn't vote yes on this.
no, you did not. And we wanted more information about, rate comparisons.
Okay,
How
perfect.
one ride would compare to another, just to kind of get an idea.
Okay, perfect.
And then in a moment, we're gonna hear maybe a little bit more from Amy about some feedback she might have.
Hey, Janet.
Thank you.
I see 20 of, so we're moving right along. Matt, go ahead.
For the survey we were just discussing, do you have an exact date that it needs to be submitted by? I know you said it wasn't soon.
No, I don't, because
Okay.
they're being flexible about it relative to, I will look at my email to see the exact date. It's my responsibility.
This, Fred put in his email, please plan on completing and submitting it within a week of your RCC's next meeting.
Right, and a lot of the RCCs, Kathy, I know aren't meeting for another week or so I felt we got a little bit of wiggle room because we were meeting the week following him sending out that email late in the afternoon.
Mhm.
So I think we've got another week that we can get this done.
Perfect. Thank you.
Yeah, some of the other RCCs aren't meeting for another couple of weeks, so. And some of them only meet quarterly. Some of them only meet every other month. And I think we're the only one that tries to meet every month, which we may look at. Maybe next meeting, have a discussion about that, try to go to every other month. If we can figure out in advance the months that we need to be able to meet relative to New Hampshire DOT votes and requirements.
Yep.
So stay tuned. There's another agenda item for next month, or the month after. Keep March on your agendas, but seriously, folks, if there isn't a great need in March, we may postpone to April. But I think we need to gauge by what's coming in and what's coming through the portal.
When would we start the budget process in April, April-ish? for like the new fiscal year?
That's why we were asking Merrimack. I mean, we have a budget in play.
Yeah.
We've got one other piece that's gonna be coming forward. We can do it in April. It's a rate change. But this budget's pretty well set, yeah. All right. I'm just gonna give you guys statewide information real quick. Did you want to, as our member of the SCC, would you like to share anything in addition?
In lieu of you doing it, or I'm happy to do it.
Go ahead.
Okay, so the SCC, I think everybody knows, is working on the SCC strategic work plan. I am a part of goal number 1. There are 5 goals. Everybody on the SCC is assigned to a goal, every voting member, and then we have additional people who are not voting members participatory in this as well, and I'm grateful for that because it's truly the end user involved. We have another thing that is, I put this out there because we have determined that the 91A is as rigid as we believe it to be for subcommittees. So all subcommittees need to be acting as if they were the full committee, and that has thrown a little wrench in when people started meeting because we wanted clarification from the AG's office. We are planning the annual meeting, which we've locked down the date of June 4th. Is that annual meeting? It will be at the Graffoni Center. We're putting the agenda together now, and the speakers that we're going to have there. So that is well underway. I will remind people that the SCC also has their annual meeting at that conference, as well as New Hampshire Transit Authority has their annual meeting. It's 15 minutes. It's generally just for voting in on the executive team. So that will happen if anybody on the SCC wants to raise their hand to be in an executive role. That will come out in the March SCC meeting. So of the 5 goals, all of those teams have met. Angelique is waiting for her appointment into the SCC from the Governor and Council, which is expected to happen on March 4th. She will then be the owner of Goal 1, which is the communication between the RCCs and the SCCs. So every team has met. Some of us are realigning when our goal expectation date will be completed. It's a 2-year plan, and we're doing that because we didn't start meeting until after the January SCC meeting because we wanted the confirmation on 91A. So we've all officially now have met at least once. We're getting feedback from all the other meetings, which have been great. We are looking to hopefully have some standardization with those meetings as it relates to what an agenda looks like, what our meeting minutes look like, so that we can just have standardization. Goes up on the Keep New Hampshire website, moving, and it all kind of looks the same. So it doesn't look like it's not. So we talked about that yesterday, actually, at the leadership meeting of the SCC.
And the other thing I'm going to throw in here too is if anyone's interested in any information specifically about the SCC, which is State Coordinating Council, if you go to keepnewhampshiremoving.com, there's a tab there, and all the meeting minutes are out there. The strategic plans out there. You know, that's the site where you can find the ride planner and transportation resources. And there's also regional information out there. And yes, our regional tab was updated at one point, but it still needs to be some tweaks on it. So again, work in progress.
Yeah, there was an old SCC website prior to the Keep New Hampshire Moving. That is not updated anymore. So if you see an old one that might be put out by DOT, that one's not really updated anymore. So go to the Keep New Hampshire Moving website, and that has it. And if you just go in the About Us, it's right there, Statewide Coordinating Council for Community Transportation. So it gives all of that. I am going to give a plug just because I feel like I need to. We have a position open on the council. And if anybody wants to hear about that open position, I run the governance committee, so I would be your point of contact if you just want to hear more information, what's the commitment, anything like that, huh?
What's the open position?
It's one of the 8 on the
It's one of
bottom.
the 8 that the
Yeah,
governor
so
appoints.
there's specific. So it's a statewide organization, it's a disability organization, it's a transportation provider. So there's very specific guidelines that people would have to fall into. But I'm more than happy to talk to anybody who would love to join a governor-appointed council, because it's super fun.
It used to be that we had a representative from the urbans there, that Mike was sitting on that. Is there any possibility of looking for like Camille or someone?
Yeah, I mean.
Like
anybody
replacing that
can.
role.
So it's less about, like, I know Camille's on the NHTA one, she's on that. So it can be a rural transportation provider. It doesn't have to be how they transport.
You already have a rural transportation provider that's filling in a spot, Terry Page.
Terry Page is, yes, but she's one of the 8. She's not one of the 7 designated from a commissioner or something like that.
Okay.
So that is where, so we have spots. So I would love to hear from anybody, or if you know somebody and you want to tell them to reach out to me, I would be happy. We do have 1 spot open that I would always love to fill. So that's my plug on that.
And just to kind of follow up, what you're going to hear in probably a month or so is that there's a document that the Goal 1 committee is working on relative to the reporting between the SEC and the RCC. And once that draft comes out, we will be feeding it back to the RCCs for additional feedback. Again, end user feedback, to make sure that we've kind of covered the bases and what?
Imagine that.
Imagine that. I happened to wheedle my way onto this committee as a stakeholder because it was one of our goals. So that will be coming.
Our goal is to have that out by May 4th, that Monday, first week in May. And it truly is eliciting feedback. We want it like, did we get this right? And that's the one that Angelique will own at March 4th.
The other, just quickly, and I don't want to take up way too much time because I know we're almost at the end. The other 2 goals, though, for those of you who may not remember all those papers that we gave out months ago, one of them has to do with performance measures and data requirements. And then the others.
I had it up and then I just shut it off. I was when near in the end. So we're on the one where it's kind of opening the lines of communication and being better responders to each other, and it's very important that it's reciprocating regardless of how it goes. If we're asking the RCC information, we should be able to provide the same information back, because that does not always happen. And we recognize that and want to make that process better. So that I can tell you, but hold on, it's right here. They might be holding off on goal 5 because
The title, which is topic.
well, I don't know. Let me get to it. But it's all around budget and it's regarding the Rural Health Transformation Grant.
Okay.
So until we know more about that, we don't know. So let me just pull this up real quick. But that is something that might go on hold so that we can get it done. All right, so goal 1 is the communication. And here it is. And this is how I had it up because that's how I knew it was adopted on October 2nd.
I'm sorry, I didn't see you put it down. I just thought you
Yeah,
might
no,
have it there. We just throw it in. So, you know, we got some new people and some people that might just read a refresher.
Goal 2 is regarding lived experience. So it's elevate equity and lived experience in the decision-making process. That was actually a goal that I requested because that's important to me. Modernize data and finance systems to support braided funding. So that Jesse, has been a champion of that for many years now. Goal 4 is lead statewide community transportation coordination across plans and partner. This will have to do with the community transportation needs assessment. And then goal 5 is, so it's goal 4 that they asked to put on hold. Goal 5 is strengthen public communication and awareness. So that's everything that goes out to granted staters. So those are the 5 goals. Yeah.
And
So
what's interesting is that their goal 5 is actually part of our goal about communication too, because I think, James, I think you asked the question at the meeting that we had about the LCTP goal prioritization was, who's our target audience?
Yes.
And again, the answer was, well, we've got riders, we've got prospective riders, we've got municipal government, I mean, we've got a lot of, so what can we do to better communicate both as an RCC together and to support what each of our agencies is doing?
And that's why that form that Janet was talking about earlier for standardization of like what Angelique created, which is a very nice quadrant kind of issues log. The standardization of the meeting minutes will help when we go to put it on the website and have any community person go in there and look at it and say, okay, this is clear, concise communication. It's not what we vote on. It's a summary of all the things that we talked about. So I think that helps with getting other people engaged in what we're doing. So they're not seeing all the minutia of meeting minutes, but they're seeing like the high level, what's going on by region.
But I think that this is a summary of, we have our meeting minutes. This is a summary that would be done as a report, potentially quarterly. I mean, frequency hasn't been determined. But at least I would think at least quarterly kind of thing.
I think quarterly is good. Because lots of times we don't have movement in 1 or 2 months. It takes time to create it and maybe create data. So I don't think we should be overzealous in providing it more than quarterly.
So I know that this is all structural. There are things coming, but we are all concerned about being able to provide rides and money and what riders need. So Donna, do you have anything really, really hot?
I actually do, Janet. So this morning, Jay Minkara, who's our executive director, asked me to read this to the group, to the council, because he received a CC and I received the original email. And this is from Commissioner William Cass, who's Kathy's CEO. And it says, "Hello, Donna. I got the most thoughtful thank you note today from a client you helped. I hope she thanked you directly, but I wanted to make sure you saw this and extend my appreciation as well. I have been so impressed with the help and service the mobility managers and RCCs provide. You do so much with so little. Thank you for all you do, Commissioner William Cass." So Jay wanted me to read this. I wouldn't have read it, but Jay asked me to, and he's the boss.
That's okay, because he was commissioner at New Hampshire DOT that just retired.
Can we get that enrolled in the permanent record?
Absolutely.
Yeah, it should be.
Motion made.
All right, that's.
Should be.
That's good.
Yeah.
Yeah, and.
Yeah, Matt?
Yeah, and just to point out, the whole reason we do all of this meeting is to provide trips for people. And Donna she provides trips for people. I mean, she doesn't drive them anywhere. She makes sure they're getting trips and, so just for the record, that's the reason we do all this meeting and talking.
And it's not just Donna's rides. I mean, Nashua Transit caregivers, we're all referring over there for the outliers that can't be served.
Well, we don't always
Okay.
hear about the tough cases.
And we'll be-
is what I would say. I think Donna spends a lot of her time doing it.
Exactly, and we're going to be looking more this year. We've been saying it for the last year, but we're going to figure out a way to really do some good outcome measure reporting relative to the rides that Donna can provide, especially through the Community Rides Program, as well as those rides that she's giving information to people and saying, this is an option for you, and letting them run with it, but to find out, did they actually make that connection?
Yeah, and you all should be very proud about how you contribute to that. This directly fills gaps in transportation, where it doesn't exist. So you all should be very, very happy and proud that you participate in this, because we are filling gaps.
All right, other member updates. Anyone got anything hot going on? Not seeing Carrie's hand up.
Oh, I don't have anything.
Okay.
I did just want to note that Angelique had to jump to another meeting, but she says thank you for a great discussion. And Marissa also had to leave early for a meeting with a patient, but she said, thank you so much for the work you're doing to address the transportation barriers in our community, especially those who utilize wheelchairs. Transportation is one of our biggest barriers at our clinic, so I'm excited to continue to see how we can continue to close the gap.
Yep. Definitely.
So just wanted to share that with the group.
And Amy, I promise you we'd come, we would get to it and we will. Couple of minutes. In a synopsis, home base. What was the feedback that you wanted to share?
I try to get a ride through them.
Mhm.
And I got the ride, whatever, they gave me the price, whatnot. And I was hoping for the guy I was talking to was gonna give me the ride. And he said, oh, it's somebody else. And I said, I don't drive, I don't do rides.
Mhm.
And then, so the day of the ride, because I was supposed to go to my dad's grave that day.
Mhm.
He was out driving some school kids. I said, wait a minute. So you said you can't drive and yet you driving school kids? So that's like a right hand in a cookie jar, yeah.
And what was the time frame of this? Was this within the last couple of months or is this within the last year?
It was about time I was a year ago.
About a year ago, okay.
That's why I'm not a fan of them.
Okay. Thank you very much for the input.
I don't trust them with when he said that to me, I was like, that's like a red hand in a cookie jar.
Mhm.
Like a lie, you know what I mean?
Okay. Thank you very much.
You're welcome.
All right, anyone else got anything? Thank you all for taking the time to come. I'm just gonna say, good luck.
Thank you.
Good luck. When do you think you'll be back?
Precisely.
Yeah, really?
Yeah.
September, no.
No, the middle to end of June.
Do you know who your replacement's gonna be?
So her name is Cindy and she works in the finance department. So she has a full-time job in finance and
Yeah.
she's, taking over some of the welfare roles. So I don't think that she'll be able to, come to these meetings, but she's available there if anything comes up.
Just who to contact short of your town administrator, because just in case something came up.
Yes.
And I don't want to go as too far up the ladder.
Sure.
If we can go to the right person that's doing the work.
Yep, absolutely. Yeah, Cindy.
Thank you.
I hate to do this, are you having a boy or girl?
We did not find out. Yeah, so we don't know. Yeah.
It's gonna be a surprise.
A surprise,
Mhm.
yes, thank you.
Great.
Motion to adjourn?
So moved.
Second.
Great. And you know what? It's supposed to be roll call. Carrie, say yes.
Pressure.
She said yes.
Yes, I said yes, sorry.
There we go. Thank you, everyone, very, very much.
Thank you.